it's Jen. I'm going to be your nurse today. Close the curtain. May I have your name and date of birth, please? Oh, these gloves on. Okay. Check your wristbands. Okay, name and date of birth matches. No allergies, I see. Is that correct? Okay, great. So how would you like to be addressed today? Okay, and then what's your gender identity? And your sex assigned at birth? All right, perfect. So today I'm just gonna do a head to toe assessment on you before the provider comes in. So I'm gonna ask you some questions and I'll start at the top and go down. Does that sound okay? You have any questions before we get started? Okay, great. So do you know where you are today? Do you know what the date is today? And who the president is? Okay, perfect. So what brings you in today? Okay, when did that start? And where does that hurt? Can you describe the pain for me? Okay. And then on a scale of 1 to 10, what would you say the pain is? Okay, about a 7. Okay. Anything make it better or worse? Okay. Any other things that, any other affected systems? Does the pain radiate anywhere? Does it move throughout your body? No. Okay. Does it affect your daily life? Okay. Do you have any allergies to medications? Okay. Do you take any medications currently? Any herbal supplements? Okay. Do you have any past medical history? Any diagnoses? Okay. And any past surgical history? Okay. Any recent hospitalizations? Okay, any family history, genetic conditions, or chronic conditions of your immediate family members? Okay, and then what do you eat and drink in a typical day? Okay, do you drink water? You drink enough water? Okay, do you exercise? Do you smoke? Do you drink alcohol? Okay, about how much do you drink a week? Okay, any recreational drug use? No? Okay. Do you feel safe at home? Do you feel like you have a good support system? Okay. Any suicidal ideation? No? Okay, so I'm gonna move on to the physical assessment. So like I said, I'm gonna start at the top and go down. So I'm just assessing for facial symmetry and neck symmetry. Looks good. Can you squint your eyes shut for me? Raise your eyebrows up, grit your teeth like this. Okay, it all looks good and symmetrical. So I'm just gonna take a look in your mouth here. It looks pink and moist, which is what I would expect to see, which is great. So I'm gonna check your pupils. Just gonna turn a little bit this way. Okay, so I'm gonna go 2 swipes on this side and 2 swipes on this side with my pen light. Just look right at my nose. Okay, pupils dilating and constricting as expected. Now I want you to just keep your head still and follow this pen light with your eyes. All right, looks great. So now I'm gonna move on to your upper extremities, or your arms. So I'm just assessing for warmth. Everything feels warm and dry. Skin feels warm and dry, which is great. Okay, I'm assessing for skin turgor. Patient appears well hydrated. Using tap refill, which is less than 3 seconds, and that's good. I'm checking the nails for any clubbing, any brittleness or pitting, and they look round and strong, and so that's good and expected. Palpate radial pulses bilaterally. They feel equal and strong, which is great. That's what I expect to see. So now I'm gonna move on to the front of your chest. So I'm gonna go ahead and lower your gown. Okay. And so the patient's chest appears symmetrical, no retractions, got a 2:1 ratio, so no barrel chest, which is great. So now I'm going to palpate the chest for any crepitus. Okay, any pulsations, abnormal pulsations or vibrations. I don't feel anything, so that's great. So I'm gonna check your lungs now. Just take a deep breath each time I place my stethoscope, please. Deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. Okay, now I'm gonna check your heart. So I'm gonna do with both sides of my stethoscope. So if you have any questions, just hold them till the end, please, so I can listen. Okay. Okay, and that all sounds good. Your lungs are clear and your heart sounds normal. Okay, cover you up. Now I'm gonna lean you forward because I'm gonna do the back of your chest. Okay. All right, so I'm just assessing for symmetry, retractions, and I don't see any, so now I'm gonna palpate for any crepitus. Oh, sorry about your gown. Okay, and that all feels good. I'm gonna take a listen for your lungs in the back. So again, just take a deep breath each time I place my stethoscope, please. Okay, deep breath. Breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, lung sounds clear in the back. That's great. I'm gonna lean you back here. Make sure you're covered. Okay, how you doing? I'm gonna check your abdomen next, so I'm gonna go ahead and lower you down. Okay, I'm gonna lift your gown now. Try to keep you as covered as possible. Okay, when was your last bowel movement? Okay, and then are you passing gas okay? Great. So I'm just gonna listen to the 4 quadrants of your abdomen for bowel sounds. Okay, bowel sounds present in all 4 quadrants, normal, active. So now I'm gonna palpate for any tenderness or masses. You just let me know if you have any pain, okay? Lightly palpating. Don't feel any masses, that's good, no tenderness. Okay, cover you up. Now I'm gonna move down to your lower extremities. Okay, oh. I'm assessing for color and warmth. Feels warm, color's good. So I'm going to check the 2 pulses, so the dorsalis, or the posterior tibial first. Feels equal and strong. Dorsalis pedis. Feels equal and strong. Okay, can you push on my hands for me? Okay, and then pull back. All right, looks great. Do you have any questions before the provider comes in? No? Okay, do you want me to keep you laying down? Okay, I'll keep you laying down. What's your pain score right now? Okay, 0 out of 10, that's perfect. All right, so bed is low and locked. 2 guardrails up, call light within reach, questions answered, pain assessed.